Dear students, welcome back to this chapter, Plants in Complementary and Traditional Systems of Medicine. So up till now, in this chapter, we have studied about different traditional medicines and methods of diagnosis and also treatment procedures. Now we come to the interesting part, the scientific basis of such traditional medicines. So traditional medicine was not lost in antiquity, as did many other ancient practices with development and progress of human civilization. So it can be said that traditional medicine has survived the test of time and it is still practiced almost all over the world. And herbal treatments are the most popular form of traditional medicine and are highly lucrative in the international marketplace as well. So traditional medicine has enough scientific basis and credibility, which will be shown in the examples below. So starting out with number A, so we see that phytochemical and pharmacological investigations have shown that plant components of most traditional medicines that are used for oral disease, wounds, and skin infection contain antibiotic and anti-inflammatory principles. So that there is the proof or the scientific proof that these plants actually work. They are also present in most of the plant materials recommended in traditional medicine as toothbrush and chewing sticks. Here on this particular slide, you will see that a plant-based medicine has been applied over a wound. We also see that traditional medicine is used in a lot of skin issues, for example, for treating acne. So if you see the example, tea tree oil, lemon juice, aloe vera, garlic, jojoba oil, and sea salt. All of those are natural components, and you can see that because of traditional medicine, we still to this day we apply all of those whenever there is skin issues such as acne. Number B, the ingredients of most traditional medicine used in the treatment of gastrointestinal and skin diseases have been found to contain tannins, which possess astringent and antibiotic properties. So once again, there is the proof that even science agrees that the plant components used or the traditional medicine used in the treatment of gastrointestinal and skin diseases have tannins, and that's why they can give astringent and antibiotic property. Number C, we see that the plant components of a number of traditional medicines used in the treatment of stomach troubles contain fixed oils such as emollients. And we see that these emollients can diminish gastric acid secretion. It can also help in peristalsis and pyloric tone. Number D, most of the plant ingredients used for curing gastrointestinal disorders contain volatile oil, and it is scientifically established that volatile oils enhance appetite and facilitate digestion by promoting salivation, stimulating secretion of gastric fluids, and it reduces biliary and gastric colic through carminative action. So here you see some of the ingredients with carminative action. So a carminative, also known as carminativum, is a herb or preparation intended to prevent formation of gas in the GI tract and to facilitate the expulsion of said gas, thereby combating flatulence. Number E, you see that the leaves of neem tree and roots of bawla tree are used for treating fever, including malaria fever, which have now been scientifically demonstrated to possess definite antipyretic and antimalarial properties. So, traditional medicine have been using neem and bawla tree roots since ages, and now we know because of the progression of science that they do have antipyretic and antimalarial properties. So we also see that hundreds of other similar examples of plants used in traditional medicine are there, whose therapeutic efficacy and rationality of use have been established scientifically by isolation of different components and pharmacological testing of their chemical constituents. It can therefore be said that the traditional medicine is a scientifically valid system to a certain degree, as the properties and actions of the drugs used in the system are backed and supported by scientific investigations. Traditional medicine is practiced in almost all the countries of the world, including developed and developing alike. And although many people prefer traditional medicines, critics of this medicine dismiss them as ineffective and useless. And in the light of this contradiction, the merits and demerits of traditional medicine will be discussed further. World Health Organization and its member states cooperate to promote the use of traditional medicine for healthcare. The collaboration aims to ensure the use of safe, effective, and quality products and practices based on available evidence and acknowledge traditional medicine as part of primary healthcare to increase access to care and preserve knowledge and resources. And finally, the collaboration also aims to ensure patient safety by upgrading the skills and knowledge of traditional medicine providers or practitioners. The merits of traditional medicine are as follows. More acceptable to the common people, particularly those of the developing countries, partly because of their lower price and partly due to the fact that it is deeply rooted in their cultures. We also see that as this traditional medicine are prepared from natural raw materials by using traditional technology, they are cheaper than modern medicine. That's why it is very lucrative to many people because of their inexpensive nature. They are more accessible to most of the population of the developing countries because of their easy availability. We also see the traditional medicine as they are mostly compounded from natural substances and are believed to be readily accepted by the biological systems of the body. So we think that it's going to be more natural and our body would accept it easily. And it is also believed to be less toxic and show little or no side effects. Because the concentration of active constituent in them is usually low, and the presence of a number of apparently inactive substances which may reduce the toxicities of the active constituents if compared to chemical drugs or chemical products we use. Now moving on to the demerits or the disadvantages of traditional medicine. So sufficient scientific investigations and clinical or pharmacological experiments have not proved that the claims of efficacy of this medicine as they are done by the practitioners. So if practitioners believe in something, it has to be there has to be sufficient scientific investigations done in it, and sometimes we see that it is not the case. There are no precise or standard methods of diagnosis, and different practitioners use their own methods based on their individual experiences in diagnosis of various diseases. And that is a huge demerit for traditional medicine. We also see that most of the diagnosis techniques are unscientific and at times irrational. As I have mentioned, that they also use divination and practice of, seeing astronomical signs for diagnosis. So these irrational practices often lead to imprecise and wrong diagnosis of the diseases. And treatments of disease based on wrong diagnosis or on apparent symptoms often lead to further complications. And no definite dosage system is followed in preparing traditional medicine. And finally, some unhygienic practices are used in handling, processing, and preparing traditional medicines, making them unacceptable to many potential customers.